Hey guys, what's going on? It's Coach Bronson here, and this video is going to be super fun, kind of chill discussion that I have with Dr. Gary Shlifer, who is a really down-to-earth guy when it comes to how to approach health and fitness. I met him earlier this year at an event that we hosted at the Modern Stone Age Kitchen with Dr. Bill Schindler, and Stephen Hussey was there, Sally Norton. We had a really good time eating some meat, got to see a pig butchered, but Dr. Gary and I got to talking, and we have some very common themes in how we both approach overall health and fitness, and the idea that it's about quality of life. It's not just about one aspect or another. There's a lot of different things that go into helping somebody live a good quality life. That's what we're looking for. So he's got some good information, guys. Listen up. We're gonna talk about being your own advocate, the information that doctors actually get about nutrition and health, and what different doctors are doing on their own to get better at helping their clients. So really good information, maybe help you learn how to relate to or interact with your doctor a little bit better, give you some options on things that you can do to be your own advocate, teach yourself, and maybe help your doctor get better, get more knowledge, and help other people that way, right? Helping your doctor is a great way to help other people as well. So listen in. It's a good conversation. We have again, nice and chill, relaxed conversation about some good stuff that is going to help you practically in your journey to have a better relationship with your doctor, help your doctor help you, and move forward in your goals. Okay, take it easy. All right, today we have Dr. Gary Shlifer on. Dr. Gary, where are you located?
I'm in Los Angeles.
You're in Los Angeles. Okay, so we got a little time zone difference, but I appreciate you being on. You got a background. You're a what's your actual title? General medical practitioner? Like, how does that?
Yeah, I'm an internal medicine specialist. I'm a board certified internal medicine specialist. I did go to osteopathic medical school, which I think is important because I've got some alternative medicine training, and I definitely, my education was, they encourage thinking a little bit out of the box, at least during the medical school part. And then I went to an allopathic internal medicine training program. So I'm very much formally trained as an adult medicine specialist.
Okay, cool. And you've been doing that for how long?
Ooh, it's been about a decade now. Yeah, it's been about a decade since I finished training.
Okay, well, awesome. This is fantastic. I appreciate you being on. You have a lot of good background in fringe, I'll call it fringe medical solutions, nutrition concepts, all of the different things. That's why you're in this space, the keto carnivore space. You know, the Sapien framework is a little bit, and we'll talk about what that is. You had some part in that. Real quick, you just mentioned something that I think was interesting. Could you explain what allopathic medicine is?
Yeah, so in the early 1900s, there was all sorts of healthcare providers. There wasn't much structure at all, which was mostly bad, I think. You had a lot of people selling snake oil. You had a lot of people that just kind of made stuff up. There was, however, a lot of traditional medicine out there. There was a lot of varieties of strategies how to take care of someone. Over the last 100 years, America went through a reform in the early 1900s where basically they started accrediting medical schools. And that was a process, I think it was in the 1910s or 1920s. And essentially what they did was create the concept of Western medicine or allopathic medicine, which is really focused on, ultimately, it's focused on evidence-based model. So the idea was, hey, let's have strategies to treat people that's based in research science. And through that process evolved two paths to become a physician in America. An allopathic physician is the traditional Western medicine doctor. That's very much a disease-centered model, doctors that treat diseases. And that's where you get a cardiologist that specializes in the heart, a hematologist that specializes in the blood, and those specialties go on based on the disease processes and the different organ systems that we have. That's what people think of. Then there's osteopathic medicine, which is an offshoot of the sort of allopathic model. And within that framework, there's certain concepts that really focus on holistic treatment of patients, treating the entire patient. There's also a concept in osteopathic medicine that sort of teaches us that the body has a natural inherent ability to work towards equilibrium, and that by manipulating the body through physical maneuvers, we can help the body find homeostasis. And so that became osteopathic medicine. And for a long time, many, many decades, that was considered very fringe and sort of weird and not traditional. Over the last 3 decades, the two have really come together. And in America, an allopathic and osteopathic degree, which is an MD degree and the DO degree, respectively, have really become one and the same. You have allopathic traditional Western medicine education that's become very holistic and trying to consider the whole human. And then you have osteopathic physicians like myself that kind of go through the training, but then become traditional Western medicine practitioners. And in today's landscape, whether a doctor is a DO or an MD, in my eyes, doesn't matter so much as the individual. I think there's very much a traditional way of thinking about taking care of patients. And then there's people who incorporate a variety of different modalities. And that's where you start hearing about functional medicine practitioners, which use herbs and food as medicine. You have integrative medicine practitioners, which sort of integrate Eastern and Western philosophy and bring the sort of integrated approach to their patients. Okay. What I do, I think, is better described as lifestyle medicine.
I like that.
I guess it's still integrative medicine in the sense that I'm integrating a variety of different modalities when I take care of someone. But certainly my focus and my passion and what I try to encourage all patients is to think about lifestyle as medicine. So if functional medicine doctors think about food and herbs as medicine, I think about food and exercise and sleep, and even things like cold immersion and heat immersion and deep breathing strategies, in addition to a variety of other lifestyle, meaning things that you can do with your life. And I think that's really the true holistic approach, because it's what you do, it's what you put in your mouth, it's what you do with your body that really drives health. Yeah. And in general, I try to avoid the concept of the patient in front of me, there's something wrong with them, they're sick, I have to fix them. And instead, I try to find how to keep people healthy or keep people living a life that's of quality and not, as many pills as I can order or as many interventions, pharmaceutical interventions that I can think of. I still do that. I have to be honest with everyone. There's a role for that, very much so. But at least I work towards really focusing on lifestyle, which I think is the most important.
Okay. And would you say that is a percentage of what a lot of doctors out there are doing? Like most doctors? Because I mean, until I got into this space and really focusing on health and fitness and understanding what holistic medicine, quality of life, lifestyle solutions were about, I've never met a doctor that was worried about that.
No, I've never. Until I joined this space, I never did either. Yeah. The training is very, very much focused on treating diseases using pharmaceuticals, surgeries, testing modalities, whatever it is, CT scans, ultrasounds, using blood work. I mean, it's all about that kind of traditional, get a diagnosis and treat the problem with what pharmaceuticals we have or what interventions we have. Yeah. In training too, there's this idea like, oh, someone's heavy and they have obesity or they have diabetes, give them a 3-month lifestyle intervention. That's the answer to every board question, by the way, that any doctor ever takes. It's in there. Like at its heart, it's in there. 3 months of lifestyle modifications. But they never really talk to us about what those are. If they do, it's very, very superficial. It's very much standard American diet, get 3 or 5 days a week of exercise. That's pretty much it, you know? So there's not a real focus on what are the different nutritional strategies? What are the different ways to work out? You know, HIIT, interval training, you know, long distance, even these basic concepts that we talk about just in the ether of life, they're not really talked about. So it's not like a doctor has some kind of understanding of what high intensity interval training is. We don't get really taught about concepts like fasting, not even carb restriction, which I think is basic medicine, understanding carb restriction and understanding our food system. So none of that is part of the training. And all of that is, if you find a doctor that is into it, they've taught themselves and they've actually gone way out of the comfort zone of what we're trained to do. I was recently at a meeting and one of my colleagues asked me like, oh, how do you do it? I'm like, what do you mean? How do I do it? How do I talk about eating healthy food? He's like, yeah, I mean, you're so brave. I'm like, this is not brave. That's ridiculous. It's just, we don't get taught how to talk about it. So it's not brave for me to do anything that I wasn't trained. There's a million things that you can do to help someone be healthy, that they don't teach us about in medical school. And I don't think that it takes bravery. It just, I'm a scientist, I'm a healer. That's what I'm supposed to do. Right. But sadly, we are very much trained in a culture of fear and in a culture of do what you're told. That is very much a part of the Western medicine world at this time. So yeah, talking about an animal-based diet or intermittent fasting somehow makes me brave. That's, I guess, just an example of the disconnect between like how we're trained and what at least I do.
Okay.
So wow. I don't know very many doctors at all.
Yeah, I mean, again, in this space, it seems like they're all over the place, but we're such a small microcosm of what's really out there, you know. What is the actual training? Because I've heard different numbers, different doctors talk about the actual training that they've gotten in nutrition in their schooling and education. I heard some people say less than a day, 4 hours, 8 hours, like.
You know, my memory serves me correctly. It's like 4 hours. I don't even think it's an entire day.
Wow.
It's not even an entire day. And the interesting part, I think, is we do spend, so it depends on how you look at it. In physiology class, in biochemistry class, you learn how the body metabolizes fat, how it metabolizes sugar. You learn a little bit about endocrinology, how the hormone system works, how insulin affects the body, and a variety of other hormones, but you never learn it in the context of what you eat. So this is something that really struck me when I was in training, is there's this disconnect between the science, the physiology, the biochemistry of life, which is, I mean, you can't argue about it, right? Like how we make sugar, the process of gluconeogenesis from your liver, the process of fat storage from too many calories and excess energy consumption. That's like very basic science, but there's never, and this never happened, there was never a connection between that and what you actually put in your mouth. So there's not like, what do I teach my patients a lot about? Well, what are healthy fats? Hey, you can buy some grass-fed ghee, and that's a great cooking tool and a great thing to add to your food because it's high in omega-3s, and you know, it's a great energy source. And maybe you should avoid vegetable oils because they're inflammatory and not really natural foods, and we're over consuming them, and they're probably contributing to a multitude of health issues. Right. There's no nuance. There's nothing to that. It's very much, what should you eat? Well, what does the standard American diet recommend? So the same thing that a nutritionist, a person who's interested in health and just sitting on Google and looking up the recommendations, that's all we learn. There's no nuance. There's no intricacy. there's not even I mean, at the very least, I think there should be an education and a push about avoiding processed foods, right?
Right.
There's none of that. It's not like you walk out of med school being like, oh, processed foods are bad. You don't know that term any more than the lay person when you finish your training, unless, of course, you've gone and taught yourself about it. It's not part of the curriculum.
Yeah, so that brings up a question. I'm sure you've seen the mug or the T-shirt or the meme out there that says, "Don't," that from doctors. I've seen it mostly. Don't confuse your Google search with my medical. Right? What are your thoughts on that and how that plays into this whole topic?
It's a double. There's two truths to it. The truth is, making a diagnosis is very hard. So I had an attending a long time ago says MDs make diagnoses and DOs diagnose others. We do the same thing. Our job is to make a diagnosis, and I think that always stuck with me, because treating people, there's a variety of ways to do it, but making a diagnosis is really, it's a process. It's very much a process of thought of how to go through a differential diagnosis, break the evidence apart, look at this person in front of you, look at the objective evidence, and really come up with a meaningful differential. I think that requires training. I think that requires a lot of medical education. And I don't think, basic Google searches are going to get you there. So I think that's really, really important. However, when it comes to reviewing new treatments, like a new treatment comes out and there's some evidence about it, sure, a doctor might be more qualified to analyze that data, but I think you can jump on Google, go to PubMed, read the paper, and make some meaningful extrapolations if you're a smart person that's had any experience reading scientific papers. I also think that going through all of the different treatment modalities and all of the different options, especially for something tricky like autoimmune diseases that we don't really understand that much about, I think there is a huge role for the individual to go online and look at all of the options out there. And I think physicians are limited in their scope, just as we just talked about, right? The education is limiting. It's good. It's not bad. It's just not all encompassing. So I think it's both. I think there's a huge tool out there called the internet that you can really learn about yourself and learn about your options. But I also think that if you get a sniffle or a shoulder pain and you go on Google and try to figure out the differential, you're not going to make a good diagnosis. It's very, very hard. And I'll add one more thing. Working on yourself is quite challenging. You're biased. You are your own bias. Having a sort of a objective third person that is trained to look at the overall picture and make a conclusion, there's a huge value in that. And I don't think like AI or a Google search or anything like that is ever going to replace a thoughtful physician.
I'm so glad you said that, because in my head I'm thinking about, well, I wonder if I could just go to OpenAI and ask ChatGPT, if I've got these symptoms, what do I have, and see what it says. That would be an interesting kind of experiment, to put a bunch of different things in there and see how accurate it could be.
I think it depends on the issue, right? I think that when someone comes in with maybe like an acute issue, like an emergency type situation, I do think algorithms and AI will be very useful in those situations, because thinking on the fly and making rapid decisions in a pressure situation can be very challenging, and having some very, very mechanized systems in place to not miss anything super critical is probably going to be useful. And I know they're already working on it. But then there's the weirder stuff. And I'll give you an example, because we do have some evidence about it, like prognosticating death. Okay. Yeah. They've done some research, and it's like you can put in different numbers, like different objective lab studies and vitals. You can put in diagnoses, and you can make sort of guesses as to what someone's prognosis or likelihood of death is. But nothing will ever replace a human being with experience, someone who's seen thousands of people in a variety of situations. There's something very human and very interpretive about that, that I think, and maybe even something spiritual, you know, like connecting with that person and feeling where they're at. And really, I don't think you could make that an algorithm. Maybe in the future, I mean, this AI is just becoming a thing, but I think that there's going to be limitations to that. So again, medicine is so broad. There's so many broad strokes, right? Emergency medicine, surgery, OB-GYN, it's all different.
So that brings up another thought in the talking about the holistic approach, what's taught in schools, where people are coming from, people looking up their own things, you know, on the internet. Let's say I'm dealing with something in my life, and I'm not looking for a diagnosis necessarily. How do we know? Are there any good tips or recommendations for people? Because I like to tell people all the time, like, these are the 5 or 6 things that everybody should be doing. I don't care who you are, where you're at, what you're doing. If you do these 5 or 6 things and then you still have a problem, then you may need to look deeper. But chances are there's a handful of things that you need to be doing that are going to solve most of the issues in your life. If you were to tell somebody, like, what are the 4, 5, 6, or even 10 things, what would you tell people that, you know, you don't even need to look on Google. You don't need to look at this. You don't need to go research this thing or that thing. Just do these things, and it's probably going to get better for you.
Yeah, I think this is where, you know, my love of ancestral medicine, or thinking about our ancestry, comes from. Because I agree with you. Most people are just living a life that's so far disconnected from their biology and their physiology, and so much of the diseases and the sort of sadness we see is because people are just not living a life built for them. And I think that a lot of what you and me talk about, Bronson, is just reminding people what is the basics of being a happy human being. So I keep it simple, and I think, okay, well, what do you need to think about every day, like every day, to kind of check the boxes of being a human being?
Right.
You know, that's it. So I have 5 that I think about, that at least I talk about. I mean, there's a million. You could break this up anyway. I often have to think about, well, what can I teach someone in a 15-minute office visit? Because I still have a traditional model of practicing medicine. I have nurse practitioners and myself. We see people in clinic. We can't spend hours with patients teaching them 20 different strategies, right?
Right.
The 5 different things are, number 1, food. So understanding the food system, you could, something as simple as just avoid processed foods, or something as in-depth as my Sapien diet strategy, which is a low carbohydrate, animal-based diet with intermittent fasting. And then everything in between. But like, anything is better than eating junk processed standard American food. Anything is better than that. So I think food is probably number 1, and number 1A and number 1B is move. So, and that's where, you know, I think you and me connected, is you've got to put the right fuel in your body. You've got to put the right nutrients in your body, and then you've got to use your body. You have to use your body. If you don't move, if you're not active, okay, not everyone needs to go to the gym and get super buff like Bronson. Like, you know, it's not just that. Sometimes it's simple enough to go for a 10-minute walk after every meal, and keep your metabolism moving and keep your heart moving, you know. For me, I love running. I can't stop running. I used to lift a lot. Now I just run. It just makes me happy. Is it even like better than doing high intensity interval training or sprints or whatever? I don't care. I just like to run. And I try to encourage people to think about it, like, enjoy your life and do something that makes you feel good. The others are sun. I think getting sun exposure every day, so important. Sleep, that might be 1C. You know, I don't know if you can break those 3 up. You've got to sleep. You know, more and more research is coming out how important sleep is. And then the last one, that's kind of a catch-all, but I think a fun way to think about it, is stress. So stress management. So doing something every day to control your stress and anxiety levels. And that could be, like, for me, I love jumping in the sauna and seeing how long I could stay there, getting uncomfortable, jumping in the cold pool or a cold plunge, going back and forth. That's my stress reliever. For some people, it's the same thing as the working out. So I do relieve stress running. I do try to separate those two, because sometimes a stress relief can be spending, you know, date night with your partner, or taking your dog for a walk, even though it's cold and you don't want to, just to show them love and reconnect with them, and take your mind off of stuff. So yeah,
I think that's huge. I think connection is a huge piece.
Yeah. That's kind of why my stress is my catch-all, because it can mean so many different things for so many people.
Awesome. There's when we talk about quality of life, one of the big things that is big right now in the biohacking space is longevity. Everybody wants to live to be 300 years old. And I like to talk about the quality of your life as you get older more than how long you live. I'd rather live, you know, this may sound weird to some people, I'd rather live 10 years shorter, but live up to that time that I die than live 10, 15 years longer and not really have a life that entire time. And there's a phrase I heard, I don't even remember where I heard it, but it's length of morbidity. Have you ever heard that phrase before?
Length of morbidity.
Length of morbidity. And the idea, I heard this on, I don't know, TikTok or something recently, and it was, the idea is that today people really start dying at 50, right? 50 years old, 60 years old, that's when people's lives, their quality of life, they actually start deteriorating and going towards the grave. And their lifestyle is one of dying, it's one of decay, it's one of decrease. And the length of morbidity is much longer. They have 10, 15 years of just crappy lives and then they die. As opposed to someone who's living the best life possible and in their 80, they have maybe 2 days or 3 days of, oh, this is the end, but they got to live. So their length of morbidity, quality of life is much longer up to that endpoint. Is that a concept that resonates with you at all?
Yeah, absolutely. I mean, yeah, I do a lot of geriatrics, so I take care of people at the end of their life, and then I take care of people that are younger, and I prevent disease. That's sort of my version of lifestyle medicine, and all that sick care in between.
Yeah,
I try to avoid it. I don't fully avoid it, but it's not my favorite part of medicine. Yeah, what I see is that, sadly, I think 50 is actually too late. I think a lot of people start dying like in their 30s. Like, seriously. Yeah. I just noticed, first of all, I've been making, and I know that this isn't even a surprise to people, but I've been making more and more diagnoses of type 2 diabetes in people in their 30s. And so many of them are not even obese. These are people that are just consuming such crappy processed food, so much inflammatory cereal, so many processed sugars and grains that their insulin resistance mechanism falls in 30, and that's it. I mean, unless you make a dramatic lifestyle change, you're now in the dying process. You're now just kind of slowly sick and suffering. Also people know that recently is their first decade where we're seeing the life expectancy went down in America. So I don't even know, so not only are we sick for longer, we're actually dying earlier than we were before.
I just saw something the other day where I guess the CDC increased the BMI standard for kids.
I did not
Because
see that. I did not.
because kids are generally more obese. So I guess we need to just change the standard instead of making kids not be as obese, right? And the childhood diabetes and childhood issues and all these things are going on a rise as well. It's just crazy.
We're just normalizing illness. That's really what you and me are talking about here. We're normalizing illness. We've normalized obesity as something that's acceptable. I'm not, no one's here to fat shame anyone, but you cannot pretend that having a BMI greater than 30 is healthy. It's just not healthy. However you cut it, you don't have to judge people for it. You don't have to make them feel bad about it, but it's not healthy. And anyone who is and is like, I'm living my best life, all good, but you're going to get sick. You're going to get sick. Cardiovascular disease, infectious diseases, cancer. These are all dramatically linked to metabolic disease, obesity, diabetes. So I just we've normalized this stuff. We've normalized sadness and anxiety. I mean, the rates of depression, anxiety, insomnia. We've normalized pain as just something we complain about and medicate with pills. So we've normalized disease essentially, and I think that's really the problem, rather than people expecting to live a long life and be healthy, or even like you're suggesting, maybe live a hard life and go until they're done. Instead, everyone's just so afraid of getting sick that they're sick right away. Everyone's so nervous about everything happening that oh my God, this can happen or that can happen, that they don't jump to action to do anything about their own health. And I think that's really where the problem's at.
I like what you just said. They don't jump to doing something for their own health, and that's a lifestyle thing. There's a bunch of stuff individuals can do lifestyle wise, but for those people that are putting a lot of, for lack of a better word, faith in the medical institution, how does someone look at the care that they're getting and make sure that it's right for them?
Yeah, this question comes up a lot, and I think we did a meetup.
Yeah,
and this issue came up, and something I always tell everyone is, you have to connect with your physician, and any physician who's telling you what to do, I think is not doing it right. What we do is make recommendations. No one knows what's perfect for the person sitting in front of them. We have our best ideas. And I think if you have a certain approach that you want to take, let's say you want to take a lifestyle approach to your care, or you want to minimize the number of medications, I think it's okay to present yourself to your provider, whether that's a doctor, a nurse practitioner. People are all, anyone who's in that provider role, we're all a little bit different, and we all have different approaches. And I think just being open and honest, and then being willing to fire them, being willing to find someone else. I think
the doctor's always right.
Yeah, I don't know that it's about arguing or convincing your doctor that they're wrong and you're right. I think it's about finding someone you honestly connect with. Sometimes, someone who might be very closed-minded and very much stuck in their ways, if they have a bond with their patient and their patient brings to them a different approach, they can open up and try something different. I think if you don't try, you'll never know. I like to think that physicians are becoming more and more open-minded, because we know there's so much information out there. You can't possibly know everything. And our job as a physician is to always learn, always be a scientist, always question, always look for new information. And that's at least what I try to do. And I think just looking for someone who's open to, your journey. And I think that can be very challenging. I'm not saying it's very easy to find, but there's no reason to sell yourself short if you're serious about it. And sometimes the model is, I have a life coach or a health coach like Bronson, who sort of guides me through the lifestyle stuff. And then I have a physician who I sort of, check with that to make sure that there's nothing critical that I'm missing, because there's a lot of basics like cancer screenings,
Right.
and then screening your blood work that can be done with even someone who you might not fully agree with, but at least you have a good discourse with and a good mutual respect. So that there's a way to build a team around yourself that can get you the kind of care you want. I think it's really, really important people don't just settle for, I was told to do this, I'm going to do this. Oh my God, I'm afraid I'm going to die if I don't listen to them. It's never that simple.
Yeah. And I'll say too, that carries over as well into the social media, the information on the internet space. Just because someone's a doctor and they say this on a YouTube channel doesn't mean you have to.
Right. Well, YouTube and social media, just be careful. Anyone who's getting any attention online is promoting some ideology or another. I mean, even myself, I'm promoting this animal-based diet and intermittent fasting, and some people don't agree with it. They don't agree that we should be eating such a high so many animal products, or fasting so frequently, or at all. And so I'm very much pushing that agenda. Now I might see a certain patient in my clinic and I'm like, no, fasting's not for you. It's not a good fit. I'll give you a simple example. Someone with an eating disorder, I'm not going to promote fasting to them, because it's going to make it worse. And oftentimes, and then I've had other patients who I did that with, and then they later came to me and they're like, actually, because you were cool about it, I started intermittent fasting and I feel so much better. So my point is whenever you're online, whenever you're looking at a YouTube channel or anyone's Instagram, we all have to pick a side or pick a message, maybe not a side, a message, a sort of a dogma that we want to promote. And for me, it really is important to promote the kind of nutrition program that I promote, because I think it's just sadly underrepresented in the health space. Yeah. So, but that doesn't mean that if you listen to every piece of content that Dr. Gary creates and listen to the Sapien podcast, that you're going to come to me and I'm going to tell you to do exactly what I did on my podcast. In fact, the reality is I'll probably use pieces of what you heard to create an idea that makes sense for you. And I think that's the trick. That's the trick. And some people can, well, for the record, some people can consume a ton of information online, read books, and then integrate it into a very much a self-made healing journey. I don't think that's the majority of people, but I actually think most people should try, because through the process of trying to do that, you figure out what you don't know, and you realize why that Dr. Google comment is probably more true than not, because there's just so much information that even if a doctor doesn't agree with you, they've spent decades of their life digesting information. That's literally our job. So we're useful for doing that, you know. But nothing will ever replace your own search for knowledge.
That's a good point. I want to make sure everybody understands. If you're listening to this, there's the tendency in a lot of spaces, in the coaching space in particular, in the keto carnivore community, in the holistic, in the primal, ancestral, in this space where we're trying to get back to what true health and quality of life is, to be against doctors. And there's a negative connotation a lot of times with the medical profession. And I want to make sure that everybody understands is, just like anything else, there's bad doctors. There's also great doctors. And there's also doctors that will listen, and there's some doctors that won't listen. But the medical institution is a tool that, if you use it properly, and if you are intentional about how you approach it, can help you in your journey. It's not bad, just inherently bad.
Yeah, and I don't, I think there's few bad doctors. Like, I think a bad doctor is someone who's really like doesn't care and is malicious. People have to realize it's a very, very difficult job, and the same pressures that you as a patient experience, insurance companies not allowing things or creating problems, pharmacies not operating well and creating problems. Every step of the healthcare system is broken to some extent. I mean, our healthcare system is a disaster. Don't get it wrong, twisted. It's bad in every possible way. I can't even think of one thing that we really, really, really do great. I used to probably, there are some things we don't need to get into.
Marketing.
Yeah. I mean, look, we're really good at coming up with new drugs that make drug companies money. That's for sure these days. But I guess my point is, it's not really like bad doctors. It's just that they are part of a system that is flawed. And so they have their flaws that are inherent through their training, and they have flaws that are inherent because they're human beings, and you can't, they're real people. The training is hard. The demands are hard. Making the money in medicine is not what it used to be. It's very, very difficult. There's no more. And I think everyone realizes this, that rich doctor thing is like not a real thing anymore. So I think that, being really respectful and understanding to all the providers. And when you don't jive with someone, move on. You don't need to get mad at them. And I think that's a really nice way of approaching it, because I do think there's also some really bad practices that bother me, that are very much, driven by large companies promoting their agendas and doctors just kind of following suit. And I wish that wasn't as common, but unfortunately, that's probably the thing that frustrates most of patients that are in our space, is just how much of that pharmaceutical driven medicine, just aggressive pushing of pharmaceuticals. I think that's probably the thing that's turning many people off. And sadly, it's true. It's very ingrained. I always tell people, if you really want to think about pharmaceuticals and the story of pharmaceuticals, there's a great new book by John Abramson called Sickening. I thought it was very, very well written, and sort of, instead of jumping on, kind of hot button issues, he gives you examples that you might not really think of as examples of the pharmaceutical industry really taking over and manipulating. Okay. So I think it's a fun read if you're really interested in this part of what went wrong. And it's very much a new thing. People think it's been like this forever. It really hasn't. There is a lot of integrity, and there's a lot of good research happening for a long time. And it was around the late 90s, that things really took a turn for the worst. And I started my training right in the middle of this sort of overwhelming overtaking of the Western medical system by pharmaceutical industry. So I think I'm actually a direct result of that, because I am the opposite.
Right.
And I immediately, before I even really understood what was going on, was like, well, there's something wrong here. This is weird. Everything I'm being taught literally looks like it was written by a pharmaceutical industry marketing agency. So, I think maybe it's good. Maybe it pushes some doctors like myself away from there, and we become a different version of what they're trying to make. And then, hopefully that evolves. And that's why I'm out here talking about it, because I think there's probably more doctors out there than people think. It's just really, really scary to step out of the box. And again, with my story in the beginning, I was called brave for talking about food. I think it's kind of weird, but I guess it's pretty true.
Okay. So the mindset that people need to have, I think from what I'm hearing you say, is there's really two pieces to being your own advocate and making sure that your doctor's working best for you. And that is, don't be afraid to ask questions and to do your own research and bring that to your doctor. And then don't be afraid to fire your doctor if it's not working out for you.
Yeah, don't take it personally if they're not into it. Just find someone who takes it, who's interested. They're out there. Like I said, I really think they're out there. I think it's just tough because you make an appointment, you got to wait 4 weeks or 6 weeks, then you got to, often there's long line. It's just frustrating. The whole thing is frustrating. One trick I've talked to some patients that aren't in my areas, just book your first visit as a telemedicine, saves you the time of waiting in the office. Kind of get a feel for your doctor before. And if you guys really connect, then you can go see him in person. I know a lot of people do that with me, and I encourage it. I think it's super fun, and it makes for a good series of visits because you kind of get to know each other in the first visit, kind of go over some big picture items, make sure there's a connection there. And then when they come in person, we get to the nitty gritty instead of spending time doing those basics. I think, there's different ways to do it, but just remember, doctors are just people. Everyone's just trying their best, and no one's really malicious or bad, or at least I think it's very, very rare. It's hard. It's really, really hard, and the last few years have made it more difficult.
So if I think we're good. We got a lot of good information. I think this is going to help people kind of look at the whole process a little differently. What is something that a major message you want to leave people with?
Major message. I think that it is a very, very difficult time that we're living in. It almost feels like it's a wartime. It really does. I don't know. I've never really lived through a serious war, but it certainly feels that way. At least in the clinic, people are really scared. Everything from COVID and infections to just sort of, a lot of death and sort of morbidity in the news. A lot of mood disorders, which is not surprising when you lock down the society and you create all this fear. And there's a lot of real fear. It's very real. I think people are really dealing with mental health issues. And, the message I tell people that are listening to this is just get back to the basics, get back to a good food system, get back to using your body, get back to anything that helps you with your stress, and look for other fun stuff. So like, I'm a huge proponent of sauna and heat therapy. I'm a huge proponent of cold therapy and deep breathing and meditation. So Wim Hof method is a popular one. I think those kind of things, everything from the meditation to the Tai Chi to the yoga to, anything you can do that is going to change how you feel, that doesn't require a pharmaceutical.
Right.
And I think that's just the most important. And we haven't even got into, which I think is really important, is supplements. And then there's other fun stuff like nootropics. And then we get into, psychedelic assisted psychotherapy. So there's a lot coming into health. There's a lot of different things we can do, but keep it simple. If you're just starting out and you're learning about it, or you're looking for the next step, look at the simple stuff that you're missing. Try cold showers every morning and see how that doesn't change your life dramatically. Go to the gym and just try something you've never done before, and just do it for 10 minutes. Keep it simple. And I think that's where it all needs to start.
Awesome, man. Thank you. Cool. Where can people find you, and how do people, if they want to set up a call and have you become their doctor, what do they got to do?
Yeah, it's easy. So I'm only really active on my Instagram, which is at Dr. Gary Evolve, at Dr. Gary Evolve. You can reach out to me. I respond to pretty much everyone. I'm not super popular. But then if you want to see me in clinic, set up a telemedicine or consultation, it's evolvehealthcare.com. And I'm in Los Angeles, and we do telemedicine for people around the country. Sometimes it's not even medical, it's just a consultation, just a chat. Try to just open the doors to as many people as we can. So yeah, Evolve Healthcare, at Dr. Gary Evolve. That's the main way. Oh, I should mention Sapien. So Sapien is an organization that I started with Brian Sanders, who has a really popular podcast called Peak Human. We started the Sapien diet and lifestyle, which is just a way of thinking about health through the perspective of ancestry. We recently kind of went our not separate ways. We each focused on different parts of Sapien. So Brian is operating the Sapien Tribe, which is a community of people that are sort of like-minded and promoting each other. He's got the Sapien Center in Austin. I've got the Sapien sort of medical practice, which we call Evolve Healthcare. I have a supplement line, which is essentially food supplements, very basic supplements that are high quality online. And I'm always looking for new opportunities to like get out there. So that's how me and Coach Bronson met. So yeah, it's kind of just in the middle of the journey, and anyone who's interested, just reach out to me, and it's a pleasure. Yeah.
Awesome. Thanks for joining us today. I appreciate it.
Thanks, Coach.